Don and Jacob again for the Institute of Sport and Spines. Today we're doing a demonstration of a hip mobility exercise. This is a fairly complex exercise and is quite easy to get wrong. It's something that we use quite regularly in people who have poor awareness of their joint movement and joint position in their hip. It's essentially a modified squat or lunge technique. So we start by getting into a hip hinged lunge or squat position. The idea of the movement is to rotate about the hip so that the quad and foot stay in the same plane. So if this is the load-bearing side, this side can come up onto the toes, so we pivot our pelvis around this hip. So the movement looks like this, and then rotate back. So our pelvis and our shoulders should move essentially together. So you can see that movement comes around my hip itself. For some people it's easier to get into a lunge position, and once again rotating the pelvis about the hip. It's important to ensure while you do this as an exercise the knees don't do this, because in this position both sides of my pelvis are moving. It's not pivoting around this hip. When you're really effective at it, you can maintain the same position, pivot through, roll back, pivot off this foot so that rotation is around this hip. As you get better, sit deeper into the movement, and same mechanism. That concludes our hip demonstration for today.